Hey guys, I'm a day late, but it is Wednesday, February 1st, roughly about 2:30, 3 o'clock. Um, so, this is Kiki again. Don't mind me, I look really naked. I'm pretty much is naked. But I know most people didn't want to know about all that. But anyways, so update for this week. I have noticed that a lot of my stomach pains have slowly but surely decreased. I'm not having much stomach pain as far as like this first week or two that you feel that type of stomach pain. I haven't had any of that really. I'm still having to learn how to take my time when it comes to eating or drinking. Now it's more just drinking. Even though I'm able to take bigger sips now, um, I kind of go overboard a little bit because I be so thirsty. The last few days, I have been barely having an appetite, so I'm barely eating. I'm making sure that my fluids are up though, because I don't want to be malnutritioned as well as dehydrated. Those two combinations, I'm pretty sure, is not a good combination at all. But I'm loving the fact that I'm able to drink a lot more fluids. As far as like, I guess my stomach is kind of really settling now. I still get the air bubbles, and I can sometimes hear them coming from my stomach. And then I can, if I have my mouth open, I can kind of hear them coming up my throat, which is kind of weird, but it's a new thing. But I'm loving the fact that I'm able to drink more than just those little medicine cups. I'm probably drinking, instead of like using those for 3 sips or so, that whole measuring cup, trying to take 3 little sips out of that. I'm probably able to about have one measuring cup, one of those medicine cups full of fluids in my mouth at once, and able to drink that. And then it's just more of making sure that I'm not guzzling. It's more of making sure that I'm drinking what I currently have in my mouth, and then waiting a couple seconds and then taking another big sip or whatever. Uh, as you can see, I'm still smoking. The first time I tried to smoke after surgery was horrible. Um, but this is kind of a stressful time for me, just recovering completely and whatnot. So I definitely have been smoking. I know I said I was gonna start this journey as a non-smoker, but it's difficult when you stress smoke. Uh, so yeah. If you guys haven't been able to notice, my face is slowly but surely going down. I can see a lot more of my neck now. Um, oh, and that brings me to my update on my weight. So I went to the doctor yesterday for, I went to my pain clinic. I didn't go to my normal doctor as far as my gastric stuff is concerned. But I had to go to the pain clinic to get a med refill. And I was so excited to go because I knew they had a scale, and I knew that they were going to be weighing me, because in order for me to have the back surgery that I need to have my BMI go down. And the last time I went, I go, or I was going every other month to the pain clinic. And majority of the time they wouldn't weigh me, but I'm pretty sure the last weight they got on me was like 3 something. And when I checked my weight yesterday, I was down to 287. And I am super excited. Like within Let me see. The last time I went to the doctor was the 18th for my gastric stuff. And yesterday was the 31st. So within that little short period of time, I've lost another 10 pounds. So I am super excited. It's like every week I'm losing more weight. And I mean, I know eventually the stars are gonna possibly come or whatnot, but it feels so good to go to the doctor and be excited to check my weight because I know I've lost a few pounds or whatever. To be honest with you, if I lose 1 pound in a week, I don't care. I'm excited to see that number decrease. Um, so I am now down to 287 pounds and 0 ounces. And that is a big thing for me. I haven't been down to 280 in a while. So that's just crazy. Like, I'm down to 287 pounds. I am like so happy with that. I mean, I cannot wait to get, like, my first goal is to get down to, I believe it was like 240 that I wanted to get down to as my first goal. And then from there, I wanted to get down to about 200 or like 195. And then my ultimate goal is to get down to 165, 170. So I'm slowly but surely making my way down and decreasing that number. So now my total weight loss right now is 33 pounds, and that is a big deal. Like, in a month's time, I've lost 33 pounds, which is like super fantastic. And I'm just hoping that everyone else is making their goals. Um, I mean, it's like so fantastic. I've even signed up for like these little bariatric kind of groups and forums or whatever, and it's nice to see everyone else's progress at the same time of seeing my own. And I do want to show you guys my incision, but my boobs is out, so I'm gonna just move those out the way so you guys can see. So it is healing very well. I'm noticing that it's gonna be pretty red for a while. But as you can see, there's no scabs and stuff on there right now, but I'm just thinking I've been picking at the scabs, to be honest. Because I just didn't want these nasty old blood stains. I mean, because that's pretty much what a scab is it's dried blood that hardened, and it was kind of mixed with glue when they did the closing of my incision. So I just was not okay with that. So I was picking at it. There was a couple times where I was picking at the scabs trying to get it off, and I made myself bleed, and it was like really dark red blood, or more like damn near looking black, but it was dark maroon blood. And then there was a couple times where me and my baby Carmen was playing, uh, my dog, not an actual baby. But yeah, we were playing, and I had no shirt on or whatever, and she kind of swiped my stomach with her nail and kind of opened it up a little bit. But it was just pretty much the skin layer. It wasn't anything like deeper or anything. So she's made it bleed a couple times. I've made it bleed a couple times, but for the most part, it is healing really well. And today is Wednesday the 1st. So I'm about, give or take, 3 weeks out. I think yesterday made 3 weeks that I've 3 weeks since surgery. Yeah, I can't believe it's been that long already. It seems like the time is just flying by. Um, Pretty soon I'll be 6 months out, and I am so excited about that because I just want to know. I honestly think with my weight loss right now, I think I can possibly get to 6 months and be like half of what I am now. I can possibly get to my 6 month goal, or make it to 6 months and actually be down close to my first goal, if not past my first goal. Like I can be down to 240 pounds, if not past that, by 6 months. And that would be like super great. But like the whole reason for me picking the gastric sleeve compared to the gastric bypass is I just didn't want to lose a bunch of weight at one time and just be like super like stick thin. Like that was the whole reason why I picked this surgery over the bypass, because I just couldn't deal with the Roux-en-Y, and not only that, but just losing a bunch of weight at one time. Like I mean, I'm losing a bunch of weight now, but it's not like in 2 days I'm losing 10 pounds. I'm losing 10 pounds at a roughly about a week, give or take a week and a half. I'm losing 10 pounds. And to me, that's still pretty fast, but it's faster than what I was losing on my own. But it's not as fast as losing a dramatic amount of weight in like a week. Like, I mean, some people who are on the gastric bypass, like people I know, family, friends of the family type of thing, have lost 100 pounds in like 6 months and still is losing every single day. But to me, that was just too dramatic. I wanted to lose weight at a more natural type of pace, even though I had the surgery and had my stomach cut in half or whatever. I still feel like I'm losing weight at a more kind of natural pace, even though it's not really that natural. But me losing 10 pounds in a week or a week and a half is still better than losing 10 pounds in like 4 days. I just couldn't see myself doing that. But I am going to definitely celebrate my weight loss. Once I make it to my first goal, I think I'm going to go and get me a tattoo, because that's what I want to do. I want to either go and get me a tattoo or go and have like something that I don't normally have now. Now, let me tell you guys, my eating habits are horrible right now. I mean, I'm trying to keep my fluids up. I'm no longer drinking the liquid stuff, far as like the liquid diet that I was on. I was thinking that I was gonna still stay on that for one meal a day and then drink or eat two solid meals. But right now, I'm in between PCAs, so it's difficult trying to cook for myself, and it's difficult trying to do all the things that I need to do. So I think that has a lot to do with the fact that I'm not eating the way I'm supposed to. I'm sleeping all types of weird.